I graduated from University of Alberta in 1975 with a Bachelor of Science degree and a dental degree. What made me think differently, because my ethnic background, I'm more of a European dental medicine. Like my dad was a dental physician, and in Europe those days you had to be a medical practitioner before you became a dentist. It was a specialty of dentistry. So I grew up in a milieu, an environment that you have to understand medicine in order to understand dentistry.
I think what makes him such a gifted healer and doctor is that he just doesn't encompass the physical aspect of yourself. It's much like with my people, there's the medicine wheel, and what he does is he looks at the physical, but he also encompasses your mental, your emotional, and your spirit. So he tailors his medicine to you, and not, you know, one medicine that's tailored for the masses of people. And I find that's what he has, such compassion and integrity that makes him really a gifted healer. I was recommended from a friend of mine because I had a hip joint IT band situation that after 8 years, after seeing many doctors and chiropractors, it wasn't healing properly. It was just being maintained pain-wise. And she recommended I see Dr. Elmajian. And I've seen him twice, and since then the pain on a scale from 10 has gone down to 2, and now I can honestly say it down to 1. So no pain.
I pursued this long journey of 40 years finding out what creates chronic condition. Any chronic pain I discovered many years ago, it's multifactorial. And to sum it all up, actually, if you go talk neurologically, it's the autonomic nervous system. Just like the old Chinese medicine say, you have to balance, you have to regulate. So my practice is basically regulation, not one wins over the other, harmony of the autonomic nervous system. In this office, we treat the structure utilizing in dentistry, splint therapy, orthodontics, orthopedics, or manual therapy like osteopathy, adjustments, and the function we utilize myofascial trigger point injections, acupuncture, neural therapy, prolotherapy. Then comes a biochemical component, which pertains to orthomolecular medicine. We get rid of the heavy metals, and we check their genetics and their nutritional status with sophisticated tests, and we use multiple modalities like orthomolecular medicine, utilizing IV, chelation, etc. Then comes a neuroendocrine electromagnetic component, and that's deeply felt with normalizing the hormonal status of the patient and making sure they do not have interference fields. That means focus of infection. In dentistry, the main contribution we give to physicians and naturopaths when we found a focus in the jawbone, where that one focus creates an illness in distant parts of the body. So we also look at foci in the electromagnetic component. Now comes the emotional component. In the emotional component, we have practitioners that help us with the emotional techniques, and we also utilize other practitioners in psychology, etc., to overcome the emotional burden of the patients. Combining all these factors gives us the best result to balance the patients. That does not mean that each patient needs all of the above. Now, what really works, the art of medicine, is prioritizing which component you have to use first on this patient.
I was searching for some help because I have 30-degree scoliosis, and I was in a lot of pain and a lot of upper back tension, which would then radiate down. My scoliosis is in the lower spine. A year ago, he rebuilt my lower jaw, and so since then, pretty much all the pressure has come off the upper spine, and this kind of tightness in my neck is not there anymore.
I love coming to work. I was this weekend every day in my practice working with my microscope, reading scientific articles. I study more now at my age than when I studied when I was going to dental school or science, because it has become my hobby. I really look forward to come to work every day. And I find if I'm not at work, if I'm away, sometimes I take vacations, I feel that I'm losing it, like as if a piano player not practicing for 3 weeks. I feel like I'm missing out on a component, so I'm stuck here. So my patients, don't worry, I'm not going to retire. I don't like retiring.